Spot cut his paw.
Can cats catch a cold?
I didn't know that.
Hey, Dr. Mike.
Welcome back. In today's Ask Dr. Mike segment, we're talking with veterinarian Dr. Mike Hutchinson about the cutting-edge use of stem cells to help cure our pets of all sorts of ailments. And today he's here with an amazing story of how it works, along with some x-rays to help show us how the healing is very real. Good morning.
Good morning.
Yeah, so how did you first learn about this new treatment?
Well, I've been reading about this for at least 10 years, but it's not that new. Stem cells have been used since the 60s, really, bone marrow transplants. That's a form of stem cell treatment. But now we're getting them from different tissues, fat, and that's what I'm really interested in. We call that adipose tissue. So these are fat-derived stem cells, and all they are is repair cells. We're taking them out of the animal, a cat, a horse, a dog, or a person. Well, I'm not doing that, of course, but we're taking it out, we're processing them, harvesting those stem cells, we activate them, inject them back in. And it's doing some miraculous things.
What happens in that processing that makes them so, helpful?
They're sleeping. We have repair cells in our body, and I always, like to use the analogy, they're like on a hammock. They're just resting till they're called to duty. We're taking them out and waking them up. We're getting them off that hammock, and their job is to repair, and they're unbiased, and you can inject them intravenously, and because we're taking them out of that dog or cat or horse and putting them right back into that animal, there's no reactions. It's very, very safe. And then they go in and do repair. So we're tipping the balance in certain areas, like where there's arthritis or where there's a bone issue or a ligament issue. We're tipping the balance in the favor of regeneration as opposed to scar tissue.
Wow.
That's what the body will try to do, is try to heal something as quickly as possible.
Yeah. Tell me about the story with the horse, because this really shows how it works. We have some pictures.
Yeah, a lot of times I've done about 150 animals, but mostly dogs and cats. So in a horse, and they're usually older animals with arthritis, so I don't get to get good radiographs or x-rays to show changes. But in this particular horse, we got to inject a 1.5-year-old racehorse that was a very valuable horse that got a MRSA infection, one of those serious staph infections that was very resistant in its knee.
You hear about that in people a lot.
Yeah, and it caused a bone infection that we call osteomyelitis, and it resulted in 2 cysts being left in the bone. And I have some x-rays of that before and after as we did this procedure. You see where those arrows are? Those are the 2 cysts. This is the knee of this horse. Now this horse, when it was bred, this is a very fancy horse. It was a $100,000 stud fee to get this horse bred.
Whoa.
So now it was dead lame. It's what we call grade 4 out of 5 lameness. This horse wouldn't pass any veterinary exam in the country. So as a racehorse, it was valueless, literally. So they decided to try stem cells to fix those bone cysts where those arrows are pointing, and that's just a defect in the bone. So we took some fat from the tailhead region of the horse. I got to be a guest veterinarian down in Kentucky, and along with the boarded surgeon, and we injected them into those cysts. And we have an x-ray of that showing where the needle is going directly into the cyst.
Oh, wow.
Now, typically when I do a dog or a cat, I don't have to put them directly into the cyst. They'll find their way. I just need to put them in the joint capsule. And but they wanted to show, the surgeon wanted to show that these were going directly into that cyst. So there was no doubt. And you could see that about 30 days later, we take an x-ray now, we're showing...
Are those circles kind of there? Oh, wow.
Yeah, those are the cysts. Now, this is 30 days later. I'm sorry there's no arrow there, but you can still see those cysts to the right of that joint space, that little black space in between the 2 bones. That's the thigh bone and the shin bone. There's the arrow. And that's at 60 days, and it's starting to fill in. It's starting to get better. And at 90 days, which was really neat, this horse is now clinically sound. This horse can run again with no pain. And this was a horse that was crippled. And traditionally, the only things we could do for that is perhaps inject steroids into that joint, which isn't going to heal it. We could perhaps do surgery and drill those holes, but you're going to end up with arthritis, and that's a 1-year-old horse. By the time it's 5 or 6, it's going to be crippled. And so they decided to try the stem cells. And at 5 months, this horse is sound. The bone is healed. And it's listed in the sales here in Kentucky this month for $250,000.
Whoa.
This horse went from valueless as a racehorse to now is sound again.
So it just was gone. I mean, it literally repaired itself on its own.
It repaired the bone.
That's amazing.
And that's where we are with these stem cells. They're using this in people, too. People ask me a lot about this. what we don't know yet, because we're at the infancy, is maybe that horse would have done better if we injected it again at, say, 30 days or 45 days. And that's what we're going to learn, the timing of this. But you can see that it works, and it's, nobody can doubt that. Even the orthopedic surgeons, the human surgeons that looked at those x-rays with me, just leaned forward and said, wow, nobody can doubt what's going on there.
Well, that's what's so exciting. I mean, it is still so new. You're still learning a lot more. Now, you're the national spokesperson for MediVet America.
Yeah, MediVet America has provided a kit, a little processing kit that we have right here on the table. And what I do is I take the fat out of a dog, for instance, or a cat, and I give it to my technician, and this kit has everything they need. It's kind of like baking a cake, really. It's real simple to get the cells harvested. We have a little bit of equipment, a centrifuge. We can't manipulate these cells. We can't change them. We can't cause them to morph, because that would be wrong. These are adult stem cells that are in the body. There's no ethical debate, no moral debate. These aren't embryonic stem cells. We're just using their fat, and I think that's so neat. I've been talking about it for a couple years, and now I'm going all over the world talking about this, because you can see why it works.
Real quickly, really, how much does it cost for the the owner?
In a dog, we charge $1,800, and it used to be $3,000 2 months ago, where we had to take the fat and send it outside to an outside lab. Now we can do it in-house, which has brought the price down comparably. But now we have insurance companies covering these treatments too, which is really neat. Yeah,
Dr. Mike, thanks so much for sharing this with us.
You're welcome. Thank you.
And that's all our time this morning, but if you've got questions for Dr. Mike, you can contact him at his practice, Animal General in Cranberry Township. Here's the number, 724-776-7930, or go to kdka.com/PTL. We've got a link to his website for you there.